How to help someone experiencing an opioid poisoning. Opioids are drugs that slow down the central nervous system, block feelings of pain, and can boost feelings of pleasure. There are medical and non-medical opioids. A person's central nervous system controls their breathing and heart rate. If someone has more opioids than they were prescribed, the opioids can get in the way of the signals the person's brain is sending to their body. When this happens, it's called an opioid poisoning. If someone is experiencing an opioid poisoning, their breathing might be abnormal, slow, or they may not be breathing at all. They might have a change in their level of responsiveness or become unresponsive. Someone who's experiencing an opioid poisoning might also have small or pinpoint pupils, seizures, a change in their skin color, or clammy skin. You might also see clues around them like needles or pill bottles. If you act quickly when a person is experiencing an opioid poisoning, you can save their life. If you think someone is experiencing an opioid poisoning, call 911 or your local emergency number and get an AED if there's one available. If the person is responsive and their breathing is normal, stay with them and watch them until emergency personnel arrive. If the person becomes unresponsive, check their airway, breathing, and circulation. Open the person's airway by gently tilting their head back until their chin is pointing up and check for normal breathing for 5 to 10 seconds. Check their circulation by quickly looking at them from head to toe for signs of life-threatening bleeding. If the person is unresponsive but their breathing is normal, give them Naloxone. Stay with them, watch them until emergency personnel arrive, and recheck their breathing often. Naloxone can come as a nasal spray or as an injection. In this video, we will walk you through the steps for the nasal spray. We recommend that you tell the person you're getting ready to give them Naloxone so that they can say no if they become responsive. Naloxone nasal spray. To give someone Naloxone nasal spray, put on gloves and take the device out of its package. Put your thumb on the plunger with a spray tip between your middle and index fingers. Tilt the person's head back. Put the tip of the device into one of the person's nostrils and push it in until your fingers touch the bottom of their nose. Push down on the plunger and give the person the whole dose. Take the device out of the person's nostril. Continual care. While you're waiting for the emergency personnel to arrive, give the person continual care. If the person's breathing is normal, roll them onto their side. Give the person a second dose if their condition doesn't improve in 2 to 5 minutes. You can give the person the second dose in either one of their nostrils. If they become responsive, tell them what happened and that emergency personnel are on their way. The person might be upset when they wake up, so be ready to move out of the way if you need to. They could also vomit or be confused. If the person's breathing is not normal or becomes abnormal, start CPR. Continue CPR until emergency personnel arrive or the person starts to breathe. As a reminder, the basic steps you should take if someone is experiencing an opioid poisoning are: call 911 or your local emergency number. If the person is responsive and their breathing is normal, keep an eye on them until emergency personnel get there. If the person is unresponsive but their breathing is normal, first give them Naloxone and then keep an eye on them until emergency personnel get there. If the person is unresponsive and their breathing is not normal, start CPR and give them Naloxone. Confidence to act, knowledge to respond.